For years, people have debated what the best blood pressure targets are, and now there are new guidelines from the American Heart Association that recommend drug therapy should be started sooner than later. Dr. Christopher Labos is a cardiologist. Hi, Chris.
Hi, Mitz.
So, Chris, I understand the new guidelines are largely unchanged in terms of the targets, but one noticeable change is they're saying that blood pressure medication should be prescribed when blood pressure is just over 130/90. It used to be 140/90, so why this change?
I think the change is really reflecting the fact that we are getting more and more aggressive about treating blood pressure. It used to be that you could, tolerate it if somebody's blood pressure was sort of 138, 139, and it would really have to get above 140 before it triggered action. But I think they're increasingly realizing that if it is above 130, you probably need to do something about it to get them to a target optimal level, because leaving people with high blood pressure, not a good thing.
Now, the guidelines are also saying that there's more evidence that hypertension is a risk factor for dementia.
Yeah, that's true. I think a lot of the cardiovascular risk factors are also risk factors for dementia. So diabetes, cholesterol, and most importantly, high blood pressure. And that's important because we have an aging population. We have rising rates of dementia as a consequence of that. Anything that we can do to decrease the burden of dementia on the healthcare system is going to make a difference for both the system and for patients. And treating blood pressure, a relatively easy thing to do that actually has a lot of positive impacts.
You know, whenever we talk about blood pressure, we always talk about lifestyle changes. But I noticed that before it used to say, moderate drinking. Now it's saying cut out alcohol altogether.
Yeah, so my mission in life is to chronically disappoint people and remind them that red wine is not good for your heart. Alcohol is not good for your blood pressure. It increases your blood pressure. If you can, obviously quit smoking, obviously exercise more. But for a lot of people, you cut out alcohol, you can see your blood pressure drop by a few points, which might make the difference between needing to start medication or not. So it's a big risk factor out there, and frankly, less alcohol would do us all some good.
And I guess salt as well. Reducing salt is key. I love salt. I love potato chips.
I know, and it makes food taste good, but the reality is salt increases our blood pressure. So if you can cut out the salty foods, also makes a difference.
And even a little weight loss now, they're saying, can make a difference.
Yeah, I think a lot of people think you need to be in sort of biggest loser territory, that you have to lose like 100 to or 150 pounds and get back to the same weight that you were in high school. That's actually not true. If you lose as little as 5 to 10 pounds, you can see a big improvement in your blood sugar levels and frankly, your blood pressure. And again, it doesn't take much. A 5 to 10 pound weight loss could make the difference between you needing medication or not. So it's these very small interventions that tend to pay huge dividends.
Now, this report also said that it's estimated about 1 in 4 adults with high blood pressure has it under control. So what does under control mean, and why is it so difficult?
Well, it basically means at target. It means that on average, your blood pressure is at the required threshold, usually about 130/80 for most people, especially the high-risk individuals. And it's a telling statistic because it means most people are walking around there with high blood pressure that is either untreated or even unknown. And this is a consequence of the fact that a lot of people don't have a family doctor, that a lot of people don't like taking medication, people don't take their medication regularly, they miss doses. There's a multitude of reasons. And it's unfortunate because treating high blood pressure is a relatively simple thing to do. And it would decrease the risks of heart attacks, of strokes, of dementia, like we talked about. A lot of stuff, a lot of diseases would be prevented, and we just need to be better at the follow-up. And in an era where a lot of people don't have a family doctor, it's starting to become incumbent on the patients to check their own blood pressure at home so that they know if their blood pressure is well treated or not, and whether their medications need to be up titrated or not.
So I guess even if people don't have one of those machines at home, they should go to a pharmacy then and just check it?
Exactly. If you don't have a blood pressure machine at home, just go to a pharmacy and check it. They are roughly equivalent and they are just as good. And that's going to be the best check because, if you don't have a regular family doctor, you're going to have to take matters into your own hands.
Okay. Thank you very much for that, Chris.
My pleasure. Take care.